Hey everyone, welcome back to another webinar. It's the Kidney Disease Screening and Awareness Program, and today we're talking about other careers in healthcare. So we talked a little bit about medicine, you've heard about nursing and all those hospital workers, but there's so many careers that go into healthcare, from scientists to sports medicine, all the way to social work. So we're gonna get into all of those different careers and hopefully we'll get you excited about it. So to start off, hello everyone. My name is Serena Verma. I am a senior here at UConn. I'm studying physiology and neurobiology, and I am going to be graduating next semester. Also, I'm from a town in Massachusetts called Acton.
Hey guys, I'm Rohan KDSAP. I'm a sophomore right now. I'm studying pre-pharmacy and I'm from Glastonbury, Connecticut.
Hi everyone, my name is Simran. I'm also a senior and I will be graduating this year as well. Currently, I'm studying biomedical engineering and I'm from a town in Massachusetts as well, Westford.
Hello everyone, my name is Smit Kadian. I am a molecular and cell biology major at UConn. I am pursuing an individualized major in healthcare and society. I am a sophomore now, class of 2023, and I am from a town in southeastern Connecticut called East Lyme. So first, let's talk about emergency medical services. So basically, EMTs and paramedics are first responders who arrive to help patients who call 911 for medical emergencies. They help with basic EMTs or advanced paramedics, life support, and transport patients to the hospital. EMTs work full-time, part-time. There's also volunteer EMTs. Paramedic is a more specialized first responder that can intubate and insert IVs into patients. EMTs are more trained in basic life support. Some departments have EMTs and paramedics, while others only have paramedics, and you usually see this commonly in cities or very busy departments where all their first responders are paramedics. In Connecticut, you can actually become a licensed EMT at age 16, and there's a link right there if you're interested to become one. And own experience in the field, I have experience as an EMT, and I will say it's very rewarding helping people out when they need it most. And I've learned a lot about how to interact with patients and become a competent healthcare professional myself. So it's a great experience that I would definitely recommend for anyone who's interested in it. The course is about, they offer summer courses that work well with student schedules that you can take during the duration of about one summer. And after EMTs drop patients off in the hospital, they turn them over to nurses, who Simran will talk more about now.
Thank you, Sumit. So as you all can see, there's a lot of opportunities to work in the field of nursing. There's also a lot of roles. It can be quite confusing giving all the qualifications and all these different types of names and titles, so we're here to just break it down for you. The good news is with the field of nursing, there's a hierarchy to things. So including an increase in pay as you get more qualified for your job, there's more things and more autonomy you have to care for the patients that you're responsible for. To begin with, let's start kind of with the lowest rung, which is the certified nursing assistant. The CNA is not technically a nurse because you don't have a license. The CNA is a nursing assistant that really does a lot of the grunt work for patient care. Basically, some tasks that you would be given would be to bathe patients, help them dress, help them eat, use the bathroom, and really perform any other daily activities. To become a CNA, you have to complete a state-approved education program, so you don't exactly have a license, and the nursing assistant training program can typically take up to 3 to 8 weeks to complete. And upon this completion, you do have to pass an exam to receive the CNA title. A lot of high school students or even college students actually do become a certified nursing assistant because it really gives you that exposure to that healthcare field. The next qualification that you can receive in the field of nursing is a licensed practical nurse, and they're also known as licensed vocational nurses. The roles that you typically fulfill as a LPN is to check vital signs and look for signs that health is really deteriorating or even improving. You perform basic nursing functions such as changing bandages and wound dressing, and you basically just overall ensure that the patients are extremely comfortable, well-fed, and hydrated. The difference between a LPN and a CNA is that when you get your license, you have to go through a practical nursing diploma program, and it will take up to at least 1 year to complete this program. And then you are required to take the National Council licensure examination to receive your state license. And that's what's different than a CNA, because as a CNA, you don't exactly have a license. Now, most people usually enter a 4-year college to become a registered nurse, an RN. And as an RN, you have a lot more autonomy. An LPN and CNA are usually highly supervised, and that's typically the job of the RN to supervise those roles. And as an RN, what you do is to perform physical exams and take medical histories. You can provide health promotion, counseling, and education. You can administer medications and other personalized interventions, and overall coordinate care. There are basically 2 levels of nursing degrees that you can achieve to become a registered nurse. And the first one of them is an associate's degree in nursing. So this is a 2-year program. The other option is the Bachelor's of Science in Nursing, a BSN, which is typically a 4-year program. It is recommended that most people who are interested in the nursing field try to go for a BSN, because a lot of hospitals prefer that instead of an associate's degree. And there are a lot of specializations for RNs as well. You can go into pediatric nursing, emergency nursing, neonatal nursing, and a lot more specializations. So it's really up to you and what your passions are. The highest qualification is the Advanced Practice Registered Nurse, the APRN. So there are a lot of specialty roles that you can fulfill as an Advanced Practice Registered Nurse. For example, I've listed some in the table, but as a nurse practitioner, you can typically prescribe medication, diagnose and treat minor illnesses and injuries. Certified nurse midwives, for example, provide gynecological and low-risk obstetrical care. Clinical nurse specialists really handle a wide range of physical and mental health problems. And as a certified registered nurse anesthetist, you can administer more than 65% of anesthetics. So now Rohan will go a little bit more into what sports medicine is and how you can find opportunities there.
Hey guys, I'm going to talk to you guys about sports medicine. So sports medicine is one of the most growing fields when it comes to healthcare. There are many different jobs that are in sports medicine, so let me highlight a few. Physical therapists generally help injured or ill people by devising a plan of action to improve their movement or just manage their plan in general. In this case, specifically for sports, they're used for athletes, but in general, they can be used for all people with chronic illnesses or conditions. For athletes, physical therapists use different types of exercise, stretching, and manipulation to increase the athlete's physical activity once an injury rehab has begun. You need a physical therapist degree to become a physical therapist. So moving on, athletic trainers are medical professionals. This is one thing that many people are confused by. Most people just assume that athletic trainers are the same as personal trainers, but this is not true. For this job, you need at least a college degree, and most states require a license to become an athletic trainer. Athletic trainers are in charge of players' injuries. When a player gets injured, the athletic trainer treats their injury by consulting with the other sports medicine staff, the team doctors, physical therapists, and coaches. And moving on, nutritionists are extremely crucial when it comes to athletes' health. When athletes exercise as much as they do, they need to have the right diet. Otherwise, they might have too much food that they shouldn't be eating or too little food that they need to eat more of. Nutritionists advise the teams and players on what the best diet is for them. And they're also used in other cases, specifically with diseases such as diabetes and chronic kidney disease. You need to especially maintain a good diet with these types of diseases because these diseases really influence the way you live your life once you know you had one of them. And if you want to become a nutritionist, you need at least a bachelor's degree. So now Samit's going to talk to you guys about physician's assistants.
Thanks, Rohan. So one of the closest professions to a physician is a PA, or physician assistant. The initial role of PAs was to support PCPs, or primary care physicians, but now PAs have far more responsibilities. Like physicians, PAs are medical professionals that diagnose illness, develop and manage treatment plans, prescribe medications, and often serve as a patient's principal healthcare provider. PAs practice in a wide variety of specialties, from pediatrics to surgical subspecialties. Practicing PAs have flexibility in their career because they have the ability to move from one specialty to another specialty later in their career. In fact, 49% of PAs have practiced in 2 specialties, and this is from a study published in 2010. PAs are also in high demand. There's been a 300% increase in PAs in just 3 years, from 2011 to 2014, and there's going to be a predicted 31% increase from 2018 to 2028. The demand is so high that 3/4 of PAs receive multiple job offers upon graduation. PAs typically have a master's degree education and have training that averages about 2 years following undergrad, although there are some special PA programs that allow you to receive a degree in less time soon after graduating high school. PA residency is not mandatory, but it allows PAs to focus on specialty and receive intense, organized training lasting from about 12 to 24 months in areas including emergency medicine, cardiothoracic surgery, orthopedics, OBGYN, psychiatry, and much, much more. Most states require PAs to have agreement with specific physicians to practice. And Rohan, you want to tell us a little bit more about pharmacists?
Yeah, sure. Thanks, Samit. So pharmacists can be extremely varied. Pharmacy is such a diverse field, so once you have the doctorate in pharmacy, you can branch out in many directions. To get this doctorate in pharmacy, depending on the school, it takes between 6 to 8 years. So after this, there is really no set job that you can pursue because of how many options you have. Most people think of someone at your local CVS or Walgreens as your pharmacist, but that's just a simple touch of the field. Pharmacy is generally split into a few categories on the jobs that are available. So the categories are retail pharmacists, academic pharmacists, and clinical pharmacists. Retail pharmacists are generally what you think of with the word pharmacist. They generally work at your local drugstore or grocery store in the pharmacy. Retail pharmacists fill your prescription and have been giving flu shots and other vaccinations out locally. Academic pharmacists are completely different from retail. These pharmacists are more focused on an educational environment, and they tend to focus on educating others and conducting their own research. Research is an extremely big field within pharmacy, and lots of people pursue this. Moving on, clinical pharmacists are the last category of pharmacists. These pharmacists work in hospitals or other patient care facilities. These pharmacists work in a collaborative environment in which they provide medication recommendations along with nurses and physicians. So even though I stated these 3 categories, pharmacy isn't binded to only these 3 categories. There's so many different fields such as nuclear pharmacy. Nuclear pharmacy deals with dispensing radiopharmaceuticals for treating diseases and different types of cancer. And then pharmacology focuses entirely on drugs and their effects on the body and how they're used. So there really is no limit to pharmacy. It's such a diverse field. And the ones that I mentioned to you are only a small amount of the jobs that you can pursue. So now we're going to go back to Sumit, and he's going to talk to you guys about social workers.
Thanks, Rohan. So a quick Google search will show you that social work is work carried out to alleviate the condition of those in need of help or welfare. And this is a very broad definition, and social work is a very broad field with many healthcare-related opportunities and careers. For example, substance abuse social workers are those who work in hospitals and rehabilitation facilities to assist those struggling with addiction, substance abuse, or mental health problems. Hospice and palliative care social workers ease the agony of families receiving news of terminal illness or bleak prognosis. Psychiatric social workers provide therapy and assess the psychiatric health of patients, working with individuals' family to make referrals, provide resources, and understand the legalities and long-term care options. They also ensure that patients are discharged only when they're ready, and they can further assist in providing mental health assessments or therapy. Healthcare social workers help patients navigate emotional, physical, and financial hardships associated with serious medical conditions. And like I mentioned earlier, these are just a small list of the many, many social workers out there. Simran, would you like to talk more about biomedical engineering?
Yes, definitely. So the field of biomedical engineering is very multifaceted, and what a biomedical engineer can do is participate in the design, construction, and development of many different technologies. For example, they could work with health monitoring devices, which could include, for example, working with blood chemistry sensors. They can work with diagnostic systems, which could include medical imaging systems like a CT scan or a PET scan. They can work in therapeutic systems such as gene therapy or tissue engineering or prosthetics, which is the more commonly known job field in the biomedical engineering field. And they can also work in more computer science related topics or subjects such as computer modeling of physiological functions. Now, given that biomedical engineering is such a diverse field, you have a lot of opportunities to work in many different settings. For example, you can work in the industry. So in the industry, you can work as a biomaterials developer, which could include bioprinting, different organs. You can work as a manufacturing engineer, so this includes looking at the design and production of products, doing quality assessments really. You can also work as a consultant. You can work as a medical technology developer, so this is more hardware and software focused type of work with medical devices. And you can become a biomedical scientist or researcher. And that kind of leads into academia. So you can also work at a research institution and lead or supervise research projects with a degree in biomedical engineering. Besides academia, you can also work in different hospital settings. You can provide advice on the selection and use of medical equipment, as well as supervise equipment performances through testing and maintenance. A rehabilitation engineer would typically work in hospital, and the job of this specific engineer would be to work on projects related to helping patients regain physiological functions, such as the ability to even walk, and basically create custom solutions for rehabilitation technologies. The qualifications that you would typically need to work in these settings at a minimum would be a bachelor's degree. So with a bachelor's degree, you would want to get it from an ABET accredited program. So you would look into the schools of engineering, and if you're applying to the School of Engineering, always make sure it's ABET accredited. So ABET stands for Accreditation Board of Engineering and Technologies, where they review the program and ensure it's official. And a bachelor's degree will lead you into an entry-level job, and from there you can definitely build up your career into higher positions. But you can also pursue a master's. So you can obtain a master's of engineering with a concentration in biomedical engineering, or you can pursue a master of science in biomedical engineering, which can help position you to graduate and thrive in a variety of different rewarding careers. And employees with a master's degree typically make at least 11K more than an individual with a bachelor's, just because you're more qualified for positions, and therefore you have more opportunities to apply for those higher end positions. But a master's degree is typically recommended just because it not only leads to higher pay and promotions, but also can lead to job satisfaction in whatever you're interested in. So as I mentioned previously, as a biomedical engineer, you can work as a research scientist, and Serena will kind of introduce what that is, what they do.
Thank you for that introduction, Simran. So as Simran kind of touched upon, research scientists can kind of work in an industry, they can work in an academic setting, but when you think of research, you might think of something kind of boring, kind of repetitive, working in a lab with pipettes or something like that. I know when I came into college, I was kind of hesitant to begin it because I didn't think it would be very interesting. But what research really is asking broad questions about subjects that really matter and then using your critical thinking and creativity to answer them in, I don't know, new ways that really haven't been done before. So in the healthcare sciences, you've probably heard a lot about research these days. So if you think about the COVID-19 pandemic, research is really, really important right now. And the field is booming and there's a lot of different areas that you can practice it in. And luckily, you can actually do research at many different levels with many varying degrees. So first of all, there's the bachelor's degree. So the bachelor's degree is a 4-year study at an undergraduate university, and this is the minimum that you would probably need to do any real substantial research in the healthcare sciences. So what this would look like is you can go and get your degree in, say, biological sciences or chemistry or physics or any kind of science that you really want to. And then after that, you can be hired at kind of a starting entry-level research position. So for example, there's a job called lab technicians, and those are people in labs that will run samples, they will help stock equipment, they'll make sure things are clean, and they'll just make sure that the postdocs and other research scientists in the lab, those experiments are running well and that they're able to run everything on time. And it's a really great position because you learn about how lab functions, you actually get hands-on experience taking part in the experiment, so you get to kind of follow a study along and you just form really good mentorships. A technologist is pretty similar to a technician, but they're usually more in a healthcare setting. So if you still want to help patients in a more direct way, you can become a lab technologist. So if you're going to the doctor one day and you get your blood drawn, a technologist is one of those people who will run those samples for abnormalities. And they're really important because they help free up the time of those healthcare professionals in clinical settings so they can spend more time with patients. And lastly, you can also become a research assistant in any type of lab. I know there's a lot of internships that you can get with a bachelor's degree at industries like big pharmaceutical companies that you may have heard of, or even just academic research labs. The next degree that you can get is a master's. So a master's will look like 1 to 3 more years after your undergraduate degree at a graduate institution. So you have to apply to this graduate program, and usually it'll look like focusing, so you'll probably be taking some advanced classes at this institution, but you'll also be focusing on a research project. And it will be extended over these couple of years. You'll probably write a thesis, and you'll have a really good relationship with a principal investigator and a laboratory by the end of this. And so after you get your master's, it actually opens up quite a few more doors for you as a scientist. You can get very similar positions, but now you'll be able to perform more research hands-on, and you'll have the ability to progress up and down in either academia or industry. You can also start to do more administrative roles, or you can keep doing hands-on research. I did a research internship last summer, and I had so many great mentors in the lab that I was working in, and some of them just had their master's degree, some of them were postdocs, but the work they did was actually pretty similar. And yeah, when I say postdocs, I mean that people who have gotten their doctorates or PhD in a science or any type of subject. So a doctorate degree is definitely a big investment of your time, but it can really help you progress and get to that management role, to that role where you can be a supervisor or a leader, and you get to really start to do your own research projects. So as you can see, it takes quite a while to get your doctorate. It can take anywhere between 4 to 6. I know people who have taken 7 years to get their PhDs, but what it looks like is basically you take advanced courses like a master's degree, and then you will rotate through different laboratories until you find something that you really like and so a subject that you are really interested in. And then slowly throughout the rest of your time, you'll form a research question that you're interested in, and then you'll work for all those years on your own project. And it is hard, and it is definitely an investment of your time, but it's very worth it in the end because you get a lot more career options and mobility within those options. So similar to the master's degree, you can work in industry. So like if you think about Pfizer or Moderna or Novartis, those big pharmaceutical companies where you can discover pharmaceuticals, work on drug discovery, or you can become a lab manager in these places, kind of take care of the workings of a lab and be a leader. Another probably common idea of a postdoc is working at a university. So usually when you just get your PhD, you have the opportunity to become perhaps an adjunct professor where you'll go and give some lectures, but hopefully when you work for a couple of years, you can become a tenured professor. And that's where you're given a lot more freedom and a lot more financial support to lead your own lab and lead your own research projects while also getting the opportunity to work with students. So overall, very rewarding path. It just takes a little bit of time. So it might be very intimidating to look at the field of research because it seems like a lot of work, but there are a lot of pros. So the first one is the flexibility to work in a lot of environments and roles. So if you, I like to compare this to going to med school. So when you're going to med school, you basically know what kind of environment you're going to be working in, right? You're probably going to be working with patients. But when you go to a graduate program and you get your master's or your doctorate in, say, biological sciences or pharmacology, you don't have to know where you want to work yet. If you want to work in industry and then switch over to a university, you can do that. And the lifestyles are pretty different, and then you can figure out what works for you. It's also a challenging yet rewarding way to master a subject that you are interested in. And going back to my med school or other school, like a nursing school comparison, you kind of have to master a lot of subjects in those school subjects that you might not like physics and chemistry and math. But when you choose a PhD and you're studying it for a long time, you can choose something that you really like and are genuinely interested in, and then it starts to not really feel like work if you're really enjoying the subject matter. And then also, it's a really fun opportunity to practice your problem solving and creative thinking. So all along the way, there's going to be ups and downs, and you're going to have a lot of kind of self-leadership in the process of doing research. But it's kind of fun because you get to choose where to go and you get to decide where to go with your project. And it can be fun for people who like problem solving. Also, you're always going to be surrounded by people who have more experience than you, even though that sounds intimidating, but you always have support from your principal investigators and the other people in your lab, so always someone to learn from. And actually one of the biggest pluses for pursuing, say, a PhD or a master's is that a lot of them provide stipends. So if you don't have a lot of money for, say, PA school or nursing school tuition, but you still want to work in the health sciences, you can actually get stipends for receiving or for going for your PhD programs. My sister is doing her PhD right now in Manhattan at Cornell, and she is receiving a very good stipend, and she's actually living in probably the most expensive place in the country, and she can still live there and do her research and not have to worry about funding yourself. And then there's also many ways to apply for more funding once you're actually there. So now that you guys know a little bit about what it's like to work in research, I had the opportunity to sit down with one of my professors here at UConn. She's a professor of nutritional science. Her name is Dr. Maria Luz Fernandez, and she told me and Maria a little bit about what it's like to be a professor at a university. All right, so hi everybody. So today we have a very special guest, my PI, who works here at UConn. She's a professor in nutritional science, and her name is Dr. Maria Luz Fernandez, and we're very lucky to have her today. She's going to be talking about what it means to work in academia. So number one, can you just introduce yourself briefly and talk about what it is you do here? What is your title here at UConn?
Yes, I am Maria Luz Fernandez, as Serena introduced me. I work at the Department of Nutritional Sciences at the University of Connecticut. I am a professor. I've been here for almost 25 years next January, and I really enjoy working here.
It's good to hear.
My question for you is, where are you from originally? And again, like I said, what led you towards pursuing a career here in academia and in research and at UConn?
Yeah, I am originally from Mexico. That's where I got my bachelor's degree and also my master's degree. but I wanted to get a PhD, so I went to the University of Arizona to get my PhD, and I stayed there for a number of years after I finished in a position, a faculty position that is non-tenure track, but those positions are difficult because you need to always find sources to support yourself, not just your research, but yourself. So when a position opened up at the University of Connecticut, I applied. I came to the interview. I really liked the faculty in the department. I really liked everything they were doing, and I was very pleased when they offered me the job. And the reason I am so interested in research is because I had a mentor at the University of Arizona that was my postdoctoral mentor, and I continued working with him for the years that I stayed there. And he was very good. He really showed me everything about, like protein metabolism, heart disease, how eating properly can affect your health, all those things. And I just continued doing this at UConn when I was hired. I was hired as an associate professor. They hired me at a greater level. Normally they hire people as an assistant professor, but they were so nice. They took into consideration all those years that I worked before having a tenure track position. So, and here I am.
Wow, so it sounds like you really found your niche here at UConn. So going a little bit further back as an undergrad, what did you study? And as you when you were growing up, what exactly led you to pursue the sciences and research?
Well, I always enjoy sciences, even since I was in junior high and high school. I had no difficulty for chemistry. I remember that all my classmates used to come to my house for me to explain the difficult problems, and I was able to do it. So I decided to do my undergraduate degree in chemistry with biology, both. And then, it was not enough for me. I really wanted to continue. So I went and did a master's degree in food science. And then finally, I decided to come and do my PhD here in the United States. But I always like science, always. I think I had, people had aptitudes for different things. And for me, it was not difficult. It was challenging, but something that I like. And so coming to the United States, I didn't have any special obstacle because I already spoke English. It was more like a cultural shock than anything else because you need to learn to do things in a different way. But then you just learn. That's the way you do it.
Yeah, I mean, you've moved so many times and from such drastically different locations. Did you have familial support along the way, or did you feel like you had to kind of navigate everything on your own?
No, I had a lot of family support. Actually, when I came to do my PhD at the University of Arizona, I was already married and I had 3 small boys. They were 6, 5, and 1. And everybody told me in Mexico that I was crazy, how I was going to even able to study with 3 little boys who were extremely active. But when you are motivated, you do it. I had a lot of support from my husband, even though my family, my extended family, did not really much approve of it. But I realized that if you have the support in your immediate family, that's all you need. And so, yeah, I always had the support. And when I wanted to come here, I also had the support from my husband. So I have been supported all the time.
That's wonderful to hear that you had the family support. So yeah, moving on towards your current job here at UConn, what do you really enjoy about being a professor and leading a lab? And are you satisfied with your career today?
Yeah, when you are a professor, and I am sure a lot of students don't realize that, everybody thinks that the only thing you do is teach. And maybe somebody thinks, okay, they do research. But we do a lot more than that. A lot more than that, because, when you get to the university, you start getting in committees that are important for you. Like, for example, you want to be able to support people and you join the diversity committees that are at the different levels of the university. Then you can become involved with a union and then help others. And you can be in so many committees, like committees for hiring new faculty, committees for salary equity. So all those kind of things is part of the job. And then, of course, you have to write grant proposals in order to get the money for your research. That's a very important part. And you also have to train your students, both the graduate students and the undergraduate students. And I have been lucky with my students. I have had students from 16 different countries. So it's, I have had all races, all ethnicities, everything with my students. I have learned a lot from them. I have graduated 35 PhDs and 22 master students. And I have had a lot of students doing independent studies in my lab and also doing honors thesis. You ask me what I like most of my job. As I said, I do a lot of things, but what I really, really enjoy the most is the students. That for me, that was like my career goal. I always like teaching. I always like interaction with the students. And just to give you an idea, I think this probably runs in the family because my father, he was a professor in Mexico and he didn't want to retire. He retired at 85. So that tells you, I probably have it in my blood or whatever, but one of the things that my father didn't want to retire is he loved interaction with the students. And so that's exactly the same thing with me. I really enjoy the students. I teach them. I like to see how they learn. And they also teach me. I mean, I am open to learning things, especially if they come from other countries or have different ways of being. So that has been the most rewarding thing of the career, the students, definitely.
That's so great to hear that, you do so much mentoring to your students and that you value that relationship. I know I'm grateful for my own PI and, his mentorship as well. My next follow-up question to that is, when you were growing up, did you have a lot of female role models who were also in STEM that, you wanted to follow?
No, to be honest with you, I did not, because I had my classmates when I was studying my undergraduate degree, but I cannot tell you that any of my female professors had an impact on me. And I probably had female role models until I was doing my postdoc, and not directly the person I work with, but people that I met in meetings and things like that. But yeah, I have not had a lot of role models. That's a good question. Nobody asked me that before. I have had people who mentor me, mostly men. That has been my life. It was not my choice. That's the way it happened. But I would have loved to have had more female role models. Definitely. I think it's great if you have them.
And we hope that if people see this and other webinars that we're making, that they will have some female role models, which is really important right now. So thank you for.
It is very important. Okay, thank you. Okay.
Yes.
Thank you for listening. Hope you guys all enjoyed the webinar and took something informational from it. Don't forget to fill out our feedback form by scanning the QR code right there, and check our website, www.UConnKDSAP.org, for other webinars. And if you have any questions, feel free to contact us. Thanks again.